Altimmune. Disclaimer: the contents of this video are not financial advice. It is intended for entertainment and educational purposes only. Purpose of video series: the contents of this video series is to educate the average biopharm investor with limited medical knowledge and background. What is Altimmune? Altimmune is an investigational clinical stage biopharmaceutical company with a focus on liver and metabolic dysfunction. What is Altimmune developing? Altimmune is developing a dual receptor molecule named pemvidutide that is both a GLP-1 agonist and glucagon receptor agonist for a host of metabolic dysfunction conditions including obesity, NASH non-alcoholic steatohepatitis or MASH metabolic dysfunction-associated steatohepatitis, AUD alcohol use disorder, ALD alcohol liver disease, with potentially more medical indications in the coming years. What is obesity? Obesity is a chronic medical condition characterized by excessive body fat accumulation that can negatively impact health. It is typically defined as a body mass index BMI of 30 or higher, calculated by dividend weight in kilograms by height in meters squared. Although in recent years, it is widely accepted that BMI is an inaccurate measurement, as it does not take into account body composition, for example, in athletes who have significantly higher lean body mass than the average person. A more accurate cutoff point is using body fat percentage, above 30% for women and above 25% for men. Certain guidelines offer even higher cutoff points, such as greater than 30% for men and 42% for women. Please refer to video 2 of this series on FDA's new guidelines on obesity treatment. Current treatment options: diet, exercise, surgery such as stomach bypass procedure, medical treatment options, GLP-1 glucagon-like peptide 1, GIP glucose-dependent insulinotropic polypeptide, amylin receptor agonists, GCGR glucagon receptor agonists. How many people have obesity? Per the CDC Center for Disease Control and Prevention, 40.3% of U.S. adults, or more than 100 million individuals, are classified as obese. Both Morgan Stanley Research and Goldman Sachs estimate that total market for obesity in U.S. to reach $70-80 billion by 2030, per KFF poll in 2024. 12% of U.S. adults by then have taken GLP-1 drug, with about 6% currently taking it in May of 2024 when the poll was taken. Receptor types among current weight loss medications: GLP-1, which stands for glucagon-like peptide 1, a naturally occurring hormone produced in the intestines that plays a role in regulating blood sugar levels, appetite, and digestion. In our body, GLP-1 stimulates the pancreas to release insulin, a hormone that lowers blood sugar levels, suppresses the release of glucagon, a hormone that raises blood sugar levels, and slows down the emptying of the stomach, promoting satiety and a feeling of fullness. GLP-1 has also been shown to reduce appetite and thereby promote weight loss. This is achieved by slowing down gastric emptying and gastric motility, which keeps the stomach and small intestine distended after a meal, leading to a prolonged period of fullness. Pros: GLP-1 can be effective in weight loss, especially when combined with lifestyle changes. It can improve blood sugar control, which was the original purpose of GLP-1 drugs, as they were designed for treating diabetes. Studies have shown that GLP-1 agonists can reduce the risk of heart attacks, strokes, and heart failure. Some research even suggests that GLP-1 agonists may improve cognitive function in people with diabetes. Cons: because GLP-1 agonist slows down gastric emptying, it may cause, especially at higher doses, nausea, vomiting, diarrhea, and abdominal pain. Usually these symptoms improve over time and are most severe when a patient first starts taking these medications. A rare but serious risk is pancreatitis, or inflammation of the pancreas. A common agonist paired with GLP-1 agonist is GIP, which stands for glucose-dependent insulinotropic polypeptide. GIP is secreted from the small intestine in response to food, particularly fats and carbohydrates. It then travels to the pancreas and binds to its receptor on beta cells, which stimulates the release of insulin to manage blood sugar levels after eating. GIP also acts on other tissues, promoting nutrient storage in fat cells, and its receptor is found in the brain, where it can influence energy balance. Pros: the combination of GLP-1 and GIP has been shown to have significant weight loss in clinical trials. GIP agonists can help improve insulin sensitivity and glucose regulation, which is beneficial for people with type 2 diabetes. GIP's effects on weight loss are thought to occur primarily in the brain, affecting areas that control energy balance and appetite, resulting in reduced food intake. Cons. Common side effects of GIP include vomiting, nausea, diarrhea, abdominal pain, and constipation, which can sometimes be severe enough to require medical attention. If a person stops taking GIP medication, they have been shown to regain most of the lost weight, especially if lifestyle and behavioral changes are not maintained. In animal studies, GIP-based medications have been shown to cause thyroid C-cell tumors in rats, though it is not yet known if they pose a similar risk in humans. The third receptor type is amylin receptor agonists. Amylin is a hormone produced by the pancreas along with insulin. It is a 37 amino acid peptide that plays a role in regulating blood sugar levels and appetite. Amylin slows down gastric emptying, which reduces the rate at which glucose enters the bloodstream and also prolongs the period of a person feeling full after a meal. Amylin can suppress appetite by signaling to the brain that the stomach is full and thereby reducing food intake. Pros. Significant and sustained weight loss demonstrated in studies. Effective for patients with diabetes. Lower rates of gastrointestinal side effects than older drugs. Amylin agonists act on specific brain regions to increase feelings of fullness and reduce appetite. They also modulate the brain's reward system, which can decrease cravings for high-fat foods. When combined with other agents, particularly GLP-1 agonists, amylin agonists provide a synergistic effect that leads to greater weight loss than either drug alone. Cons. Higher numbers of patients taking amylin report nausea and vomiting, 48% and 11% respectively. Cases of severe hypoglycemia has been reported in studies, especially within 3 hours of injecting amylin, especially for people with type 1 diabetes. Some people on amylin can develop a condition called hypoglycemia unawareness, in which they lose their ability to recognize the symptoms of low blood sugar, which can be dangerous. The last and fourth receptor type in weight loss drugs is GCGR, or glucagon receptor agonists. Glucagon is a hormone produced by the pancreas that plays a crucial role in regulating blood sugar levels. It is typically released by our body when blood sugar drops too low, such as during fasting or exercise. Glucagon is released by alpha cells in the pancreas. It stimulates the liver to release glucose into the bloodstream, thereby raising blood sugar levels. Glucagon does this in 4 ways: glycogenolysis, gluconeogenesis, lipolysis, and ketogenesis. Glycogenolysis is the process of breaking down stored glycogen, a short-term fuel source, in the form of carbohydrate in the liver. Gluconeogenesis is the metabolic process in the liver and kidney where new glucose is synthesized from non-carbohydrate precursors such as lactate, pyruvate, glycerol, and certain amino acids. Lipolysis is the process where triglycerides stored in fat cells are broken down into glycerol and free fatty acids, from which they are used as a direct energy source. Lastly, ketogenesis is the liver's process of creating ketone bodies from fatty acids. Glucagon also impacts energy balance by suppressing appetite, reducing food intake, and increasing energy expenditure, and thermogenesis, heat production from breakdown of fat and ketone bodies. Glucagon receptors are primarily located in the liver and kidney, but also present in large numbers in the heart, fat cells, adrenal glands, pancreas, and gastrointestinal tract. Pros. GCGR activation increases energy expenditure by promoting fat breakdown lipolysis and enhancing thermogenesis, or heat production. Highly effective at reducing fat accumulation in the liver, addressing diseases like metabolic dysfunction-associated steatotic liver disease, MASL, and MASH, metabolic dysfunction-associated steatohepatitis, and potentially ALD, alcohol liver disease. GCGR agonists have been shown in study to improve lipid profiles by stimulating the breakdown of triglycerides and fatty acids, as well as increasing HDL, which helps in removing LDL for blood vessels. When combined with GLP-1 agonists, GCGR activation significantly amplifies weight loss effects compared to single-agent therapies. Cons. At high doses, GCGR in theory can be catabolic, meaning it promotes the breakdown of muscle tissue. Certain GCGR, such as retatrutide, have shown to increase heart rate and even irregular heart rhythm in some cases. When used alone, GCGR agonism increases blood glucose levels. Therefore, it is typically paired with GLP-1 agonists to counteract this effect by suppressing glucagon secretion and increasing insulin secretion. The right balance is crucial in achieving this. Now that you understand the basic mechanism of action of each type of receptor, you can predict what type of effects a particular drug may have by knowing which receptors its molecule is designed to target. Next video, we will explore some of the unique aspects of Altimmune's pemvidutide and how it was designed to minimize its inherent potential side effects and maximize its potential.